Good morning, everyone. I'm Amanda Catalago, Marketing Manager with the League of California Cities. Thank you for joining us today for this webinar, Leveraging the League's Health Benefits Marketplace for Medicare-eligible retirees. Next slide, please. I'd like to start out with a couple of housekeeping items. All attendees are in listen-only mode. So if you have any questions during the webinar, we encourage you to enter them into the questions box on your webinar panel. At the end of the webinar, we'll read those questions and answer as many as we can with the remaining time we have allotted. I'd like to give you all a little background on the League's Health Benefits Marketplace. It was designed to help cities and all public agencies manage their unique benefits, contributions, and eligibility structures for active employees and retirees. And we developed this with a few challenges in mind. The main one, which was really the impetus for the Health Benefits Marketplace, was addressing ballooning other post-employment benefits liabilities, or OPEB liabilities. This was the primary reason behind the Health Benefits Marketplace. But in addition to that, we wanted to help cities address some other challenges, such as limited staff resources for benefits administration, dealing with the requirements and reporting for Affordable Care Act, and also help cities deal with the lack of flexibility in plan designs through CalPERS. The League addressed these challenges by creating the Health Benefits Marketplace, which really connects two major components. The first is a benefits administration platform to help cities manage their active employee benefits. The second, and the one that we are going to focus on today, is the retiree solution, which is powered by Willis Towers Watson's One Exchange. Now, this solution enables cities to transition their Medicare-eligible retirees to the individual market, giving the retirees more choice and benefit options, and cities can have more flexibility with the retiree health benefits contributions. Today we are going to hear from Kathy Foster. She is the Assistant Chief Executive Officer of Alameda County Employees Retirement Association, also known as ACERA. She will share ACERA's experience in using this retiree solution. But first, I'd like to introduce Chris Kelly. He is the Sales Development Consultant with Willis Towers Watson, and he is going to let you know a little bit more about what we're going to talk about today.
Thanks, Amanda. I appreciate it. As Amanda had mentioned, my name is Chris Kelly. I'm with Willis Towers Watson's One Exchange, the retiree solution here, as Amanda's mentioned. I've been with the firm for roughly just short of 10 years at this point, and about the same time that we began the One Exchange program. My responsibilities with the firm are really new business development, sales development, working with employers, both large and small, evaluating, implementing benefit strategies, and to Amanda's point, leveraging that individual Medicare marketplace for employers around the country. Just a little bit of background as far as the Willis Towers Watson One Exchange program and how we came to be is about 10 years ago in 2006 is when we implemented our retiree exchange platform. In the beginning, we were known as Extend Health. Some of the folks on the call here may know that name of Extend Health from 2006, working with a lot of private sector employers across the country in making this transition for their retirees. In early 2012, Extend Health was purchased at that point by Towers Watson, and you'll hear Kathy today as she goes through her presentation kind of refer to the firm Towers Watson as we were known when ACERA made this initial transition back in 2013. Our first conversations that Kathy will mention here began in 2011, and at the time, again, we were known as Towers Watson, and ACERA made this actual transition about 2 years later in 2013 that, again, Kathy will point to here. And then how we became known as Willis Towers Watson is in early 2016, the company Willis merged with the company Towers Watson to become the Willis Towers Watson consulting firm. So just a little bit of background about us and how we became to be known as Willis Towers Watson. And again, we work in partnership with the League of California Cities in helping public sector agencies leverage the individual marketplace on this retiree portion. To Amanda's point, and as she had mentioned, Connecture was selected through that highly competitive RFP process to work with the active solution, and so we work in conjunction with Connecture on a day-to-day basis. Again, about a little bit about ACERA, and I'll let Kathy dive into this a little bit more in detail. But they're one of our long-term public sector agencies that have been on our platform for several years now and had some impressive results, highly successful. And I think Kathy will mention that in their early transition, the reason they began looking at this program was simply seeing other organizations kind of move towards this path, specifically the state of Nevada Public Employees Benefits Program, who was one of our early adopters, and ACERA had seen and talked with them folks. As I had mentioned, Alameda County Employees Retirement Association, they began looking at this program in early 2011, finally implementing in 2013, and so you can kind of see how this process goes. I do want to point out that Alameda County Employees Retirement Association is not one of our league sponsored programs. I do want to point that out, as they are a county, of course, and not a city, but the platform is simply the same platform that we would use for the League of California Cities as well. And so with that, I'd like to introduce Kathy Foster and let her get into her presentation.
Great, thank you, Chris, and good morning, everyone. Thank you for having me here. So just a little bit of background about ACERA. We are connected to Alameda County. We are county employees, but we are a department and entity kind of quasi-separate from the county. The county has their board of supervisors, and ACERA has a retirement board that we report to and that runs our funds. Back in the 1990s, the Board of Supervisors and the Board of Retirement decided to adopt a section of the government code that allowed us to establish a benefit fund that was to provide retirees with supplemental benefits other than the pension fund benefits. And so back at that time, it was decided by Board of Retirement policy that we would provide medical, dental, and vision subsidies from that fund. Currently, it's over $800 million, and one of my main roles is to report to our retirees committee of the board once a month, present to them how our benefits are going, present renewal information to them, present ideas on any changes that would be, cost effective, but provide, good member services to our retirees, which is their main goal. Every year our actuary comes in and presents a projection of our fund based on the current benefits that we're providing to see how long into the future those funds would last. So it's the goal to always have at least 15 years of benefits provided. Right now we're at 22, which is great. But back, after the economic downturn, we were, right at or under that 15-year mark. So going to, the slide, the next slide, where we were looking at a new approach in one of our healthcare areas. We had two Medicare plans to offer our retirees. One was a Kaiser Senior Advantage, and then we had another group plan. And with the group plans, it's hard to determine what your your costs are going to be. Back then, one of the group plan other than Kaiser was about $5,784 per retiree a year, but those costs were going up. We weren't getting great customer service out of that plan. Each month when I'd be at our retirees committee, I would hear complaints. And also with the costs going up, we wanted to see if that was the best, really the best option for us. And so at that time, we started learning about individual plans. We actually had retirees call us and say, you know, if I can get an individual plan for less than what you're charging me, you know, why can't you offer it to us at that cost? Because our plan at that time was about $490 a month for the retiree. Although we provide a subsidy, you know, the dependents have to pay their full cost. And so when they can go out on the individual plan market, they were asking why, you know, are they having to pay almost double that amount? So that became of interest to us. And so at that time, we worked with our benefits consultant to conduct a request for information. So this was around 2011 that we did this, and it was really just to allow us, my team, to learn more about individual plans, how they worked, what type of platforms a group like us could use to administer benefits, offer individual plans, but also offer our subsidy to the retirees, which of course is important to support the retirees financially. So once we received some responses from this RFI, it became pretty apparent that this was a good option. There definitely was some cost savings there to consider, and so the next step was really to look into what type of customer service would these type of platforms provide, how would these providers work with us as staff, how could we partner with each other to provide the same high level of benefits to our retirees. So once we received that information, became comfortable with it, we started educating our board on the concept, also other stakeholders. We have 2 retiree associations that support retirees. Our retirees pay dues to these associations, so they have representatives that come to our retiree committee and board meetings, and we appear at their board meetings. So we educated them also, and they became very interested because of the cost and because of the customer service that could be available, and the partnership that we could establish with these providers. And so during this time, one of my colleagues and I were going to a conference, and we saw that the state of Nevada was going to speak on the Medicare exchange. And so we actually invited a couple of our trustees. We had a retiree elected and an alternate retiree elected trustee. So we invited them to hear them speak so that they could hear firsthand of the state of Nevada's experience. And there were some folks there from, at that time, Extend Health, that were available to hang around afterwards and answer some of our questions, which was nice. They provided us with just a ton of information on how this worked, and it was just so different that we asked a lot of questions, and took a lot of time to really consider this before we would make a decision to move forward. So we did go ahead and decide to release a request for proposal in 2012. And from that, we received 6 proposals, and from Extend Health, which Towers Watson was Extend Health back then, and some other exchanges also proposed to us. And in going through and again asking a lot of questions, we had a scoring panel that reviewed all of the proposals and the benefits that they offered, and really the benefits, the Plan F was really what we were looking for, because the group plan that we were switching from was Plan F plus coverage. So it was very rich in coverage, and so we wanted to make sure that there were, there was a wide variety of Plan Fs available as well as other options, which there definitely was with Extend Health. Some of the other exchanges were more limited. We also looked at member services, customer service, the education process, the partnership aspects in this decision-making process. And so Towers Watson scored highest. They were very responsive. Again, we had everybody in to interview. We developed a very respectful and comfortable business relationship with the folks that they sent in to talk to us. So we felt very comfortable and confident in recommending this change to our board. So in 2013 was when our plan coverage became effective. So going into a little bit more of the education and implementation process, the managers at that time and the staff also needed to become further educated. So we worked with Towers Watson. We developed a implementation project plan, but at the same time, we were still going out to our stakeholders, to retiree groups, to educate them further on these changes, because it was such a big change. The group plans are just so easy. That's what they're used to as active employees. And now this is the oldest group receiving their Medicare benefits, 65 or older. So it took a lot of education, a lot of trust to be developed in our decision to make them comfortable. And not everybody was completely comfortable, but we just offered continued support, that we would be there for them, through this change. In going through the implementation time period, which was from about, I would say, June of 2012 was when we started the project planning and implementation through the effective date of January 1st of 2013. So towards September and October was when Towers Watson worked with us, with our communications department, to plan some communications to be mailed to explain the benefits and the platform and the HRAs, because we provided subsidies to those with the years of service eligibility for a subsidy through the HRA platform. And so along with the mailings, we also provided some presentations, and again, Towers Watson reps came out for those presentations. I think we provided maybe 2 or 3 of them in the month of October, which is when we normally release our open enrollment material. We hold a health fair every year at the end of October, and so by November we wanted our retirees to feel comfortable with the materials and information that they received in order to make their decision. And that's the time that they started making their appointments with the benefit advisors with Towers Watson, and the benefit advisors there through phone call appointments assisted the retirees in choosing their plans. They went through where their location was, where they lived, what type of benefits they were receiving from their current provider, what their needs were with pharmaceuticals, any specialty provider needs that they had. And so the benefit advisors walked them through different options that would be best for them and help them through that decision-making process. One big change in addition to the just the medical plan was that now they would have a separate Part D plan. So that was also another education process, letting them know that they'd also have to choose a Part D plan in addition to their medical plan. So that was a little challenging, but again, the benefit advisors helped them through that decision-making process by just going through a variety of questions to determine what their needs were. So we got through the open enrollment process, and then it ended up that we transitioned 1,300 Medicare-eligible participants over to the Medicare exchange for 2013 coverage. Currently, we have about another 180 that are enrolled, And those that did enroll chose from 214 different plans from 55 different carriers. So that kind of demonstrates the wide array of options that they had to choose from, which is great because this was the group that lived in states other than California. Our Kaiser Senior Advantage group is basically in California because you have the HMO service areas. So these other plans that we had previously offered covered our out-of-state and out-of-service area folks. So the exchange, the marketplace definitely had a great variety for our retirees to choose from. But with that, you know, there was an adjustment curve. This wasn't an easy transition by any means. You know, we made it as easy as possible, but some of the challenges that we faced were, you know, helping the retirees through this. You know, again, by January, they had, you know, a lot of them had forgotten the HRA process. So the benefit advisors received calls at that time again to help them through the claims submission process. That was probably the biggest challenge for us too. We got a lot of phone calls. We do have a healthcare unit, and so our staff also helped them, but the majority of the time we had to direct them to Towers Watson because they had the information regarding the plans that they were enrolled in and could talk them through the auto payment process where they could have their premiums directly billed to them, but also taken directly from their checking account, and then how to submit claims for copays. We also had some decision-making to conduct with our board on our high-cost drug users. We did have some retirees that were using specialty drugs, and the subsidies that we had set, while they covered most of the population, we had really just a handful that were experiencing higher costs due to the drugs that they were using, and the subsidy that we provided through the HRA wasn't covering the entire amount that they were used to having covered through their group plan. At that time, Towers Watson did provide us with some options on catastrophic coverage that was available, but the board decided to not use that because it was a handful. We kind of gave them some options in using other types of drugs, looking at other plans during the next open enrollment period to decide if there was another plan that might cover them to a larger extent. So those folks weren't terribly happy, but overall, like I said, the subsidy that we provided, which went from a $500 subsidy for the group plan to a $400 subsidy to the exchange plans, that $400 covered the majority of those that were enrolled in the plans, and that is the medical plan plus the Part D plan. So with all of those that transferred over, if any issues did come up, we had an issues log that was developed by Towers Watson and maintained by them. They just actually came to our retirement board yesterday and provided an annual report, and it was reported that out of those that are enrolled, well, through 2016, that there were 145 issues that that came up and that were worked through and resolved. So that's been a good communication because we also have access to that log. It's provided to us on a regular routine basis. I believe it's a weekly basis, so that my team can look to see what pending issues are on there already and if they're being worked through in case the retirees contact us to follow up on what's happening. For the retirees, again, it was a different decision-making process for them. You know, previously they kind of went with either Kaiser or whatever other plan the county was offering. Usually the county only offered one other plan other than Kaiser, and as retirees, we had those same plans to offer. And so going to the exchange was definitely different, and Towers Watson, the benefit advisors, definitely helped us through that by setting up these appointments with them, which they do now on an ongoing basis during open enrollment, and help them through that decision-making process to get the retirees into the best plan possible for them. Using the reimbursement process through the HRA, it still is a little challenging for the new folks going into the exchange. But again, there are, support and resources through the exchange that have helped us through that. Our former group did have the RX and the medical plan bundled together. So again, having that separate Part D plan was very different for them. And again, as they reported to our board yesterday, during our open enrollment periods, we don't have a lot of change from the supplement plan, which is the Plan F, to other plans that are offered. They also offer the Medicare Advantage plans, which we do have some enrolled in those plans, but we don't see a lot of movement with the medical plans. It's mostly the RX plans, which is good because they know that as their needs change, they can contact the benefit advisors every year and let them know what those changes are that have taken place and ensure that they're in the best plans for that upcoming plan year. So going through the transition, what cost impact did it have to ACERA? We experienced very favorable cost impacts. Initially, like I said, the subsidy that we were providing to the retirees in the group plan, if they had 20 years of service, the entire premium was covered. We only cover the retiree. We don't cover the dependents. So the dependents were actually paying out of pocket the full premium price, which was about $490. And so when we went to the exchange, we looked at what the average cost would be for a Plan F plus an average Part D plan in order to reset the subsidies for our retirees. We initially set those amounts at $400 a month, or $4,800 for the year for those with 20 years of service. And then those with 15 years receive 75% of that amount, and then with 10 years, they receive 50% of that amount. So we initially projected, based on the estimated premium amounts, that we would save about 26% of our costs, or about $1,500 per retiree, and that would have been about $1.9 million a year. The projected cost for retirees, the savings would have been about $300 a month, or $1,500 a year. The actual cost savings, once we experienced a full year of coverage, was half, so about $2.5 million. We were very we monitored the costs very closely, and so every quarter we were reporting to our retirees committee what the utilization in the HRAs were, and we found ourselves very surprised at the amounts that were being used because it wasn't near what we thought it would be. And once we got through the full year, we were thinking, oh, they're eventually going to submit all their claims and we're going to, incur a lot more costs. But the outcome was that we actually only spent half as much as we did on our subsidies as compared to the group plan. So we were very happy about that. We were very happy that the retirees were getting great customer service through the benefit advisors. So with the GASB liability, as you probably know, we're looking at what our costs would be and projecting those out into the future. And so because our savings over the year was half, our GASB liability also reduced by half, at least for that group. When our actuary does our projections for us, they're now looking at not only the subsidy amounts that we are going to provide for the population, but they also look at the usage of the amounts that are being spent. And so over this is our 5th year in the Medicare exchange, and it continues to be, less than what it would have been. I mean, we don't have a group plan cost to compare to now, but we're still probably about maybe 35 to 40% lower than what we would have been paying back in 2012, which is still really great for these projections. So the average monthly premiums for 2016 that we just received in our report, for the Medicare Advantage plan, we're looking at about $63 a month. for the Medicare supplement plan plus the Part D component, we're looking at about $204 a month. So you can see that, you know, we're providing $400 a month as a subsidy, but on average, their premiums are about $204. So what we're looking at is allowing them more to spend so that if they have copays or deductibles on any of the plans, they can also submit those amounts for reimbursement, whereas with the group plan, they weren't able to do that because we were only covering the premium. So the group, as I mentioned, the group plan costs back then were $490. So in comparison to either the $204 or the $63, you can see that that's a great cost savings for us. Out of this, with the satisfaction rate, the exchange did survey those that transferred over, and so out of the 1,300 transfers, there were 32 issues identified that were resolved during that first year, and 98% of those retirees reported that they were satisfied with the transition. 93 were extremely satisfied. So we were very happy to see that, also because, again, we report to our Retirees Committee of the Board every month, and every month we hear from our retirees what's happening with our healthcare coverage and the member services that are being provided. So, so that was good news for us, and we continue to see, you know, satisfactory results coming from our annual reports from the Towers-Watson group that comes in to present to our committee. As I said, the retiree experience that we've had through the marketplace, we've been able to provide our retirees with a great choice for their medical and prescription drug coverage through the Medicare plans that are offered, as well as expert advice. The benefit advisors are certified in the states that they're in, and the plans that are being offered, they're very well trained. We did see, you know, service levels change the previous year, so that would have been for the 2015 to 16 open enrollment, but then they really beefed up the service and the staff and the training over the 2016 to 17 open enrollment period. So to me, that shows me that they do watch to see what's happening and that they will resolve any issues that were experienced if they do see any service level issues occur. So we were happy to see the report that just came into us that those service levels were improved. And yeah, and then just going through again the retiree experience, most were satisfied, and 93% were extremely satisfied. So with that, I'll turn it back over to Chris, and then I think we're going to take some questions later on if you have any for me. So thank you.
Thanks, Kathy. We appreciate it. Very good presentation. And so the next steps for this program, as you can see through Kathy's presentation, there's a lot of education that takes place, a lot of working with labor groups and different negotiation groups inside of really every agency and organization that we work with. And so there's a lot to be discussed. This, of course, isn't something that just happens overnight. We see a lot of our transitions be as few as 6 or 7 months as the transition takes place, but it can also take as many as 2 or 3 years for this entire process to go through and make that transition happen. Of course, we want to be cognizant and aware of retirees and their kind of touch and feel points to make sure that they feel like they're taken care of as well. And in the end, we want to see our goal is to see a win-win solution for both the agency, client, employers that we're working with, as well as their respective retirees, honoring those promises and you know, the value that these retirees have brought to your business over a number of years. And so through that education process, we feel like that the first step in that program is to really see how your population would fare in utilizing the private exchange solution. Now, to do that, of course, we need to have a little bit of data from you to be able to run a financial impact analysis for your population. The data that we require and the data that we need is very small. It's very minimal for us to produce this type of an exercise. And it takes our team roughly 2 weeks to turn around a financial analysis review for your specific population. Things that we need, of course, on this page, as you can see, is we need to have a copy of the current plan description. So, of course, we would want to see the design of the current program that's in place today. We need to know what the current plan costs are, that shared costs between the employer as well as the retiree participant, whatever those shared costs might be. We needed to know what the coordination of benefits is for Medicare, and also if there's any RDS filing that's taking place. As far as the census data that we would need for your retirees, as you can see, is simply gender, age, date of birth, zip code, and the plan that they're enrolled in. Of course, we're not asking for any PHI at this point. In fact, we wouldn't want to see that information if possible. And based off of this small amount of information, we're able to take that back to our actuarial teams and run a financial analysis review, again, for your specific organization to show and reflect exactly the winners and losers in utilizing a private exchange solution. And so what this analysis does is will help evaluate the results that the city as well as the retiree would see, and then we help with that future subsidy design as well. To Kathy's point, this will measure the impact to your OPEB liability, and then of course we discuss the strategy, the timing, the implementation, communication going out to retirees as part of this analysis as well. And it will show exactly what plans are available as far as Medicare Supplement versus Medicare Advantage programs that are available for each and every retiree, depending on where they reside. We find that oftentimes as participants retire and we find that they move away from their current residence, and so oftentimes these group plans don't work for that type of a participant. We want to be able to provide you an accurate analysis of what plans would be available and what the cost of those plans are wherever your retirees may reside. And so that's kind of our next step in our offering to everybody on the call today is we would ask for you to get in touch with us, and we would take this very basic information, run a review for your specific city, running that analysis to show exactly the impact to the city as well as your retirees. With that, I will turn it back over to Amanda at this point for any questions, comments coming through the panel.
Thanks, Chris and Kathy. I really appreciate everything you've shared with us today. Again, if you have questions, please enter it in the questions box on the webinar panel. Also, just so you all know, you will each receive the webinar recording and slides either later today or tomorrow morning, and we're available for any questions afterwards. I do have a few questions here. The first one is, and Chris, you may be best to answer this, but perhaps Kathy as well, is how much time should we estimate allocating to implement a solution like this?
Great question. Kathy, do you want to take a swing at this one first, and then I'll jump in, or do you want me to go?
I can at least explain what we did. Because we didn't, well, I guess I should say once we made the decision to go to Towers Watson's marketplace, that was approved by our board in May of 2012. And then it took the summer, probably 3 months, just to work through all of the work on establishing a contract, establishing eligibility files that would go over to the Towers Watson technical team, making sure that they had the right eligibles, and then going through the communication and presentations in the fall, and then allowing the retirees to have their benefit advisor appointments in November and into December. I would say that that is probably the shortest time frame. I just was at the state of Ohio last week at a conference, and they just moved into the marketplace, and they took at least a year or two to go through communications and such with their retirees. So I would say for us maybe 8 months from start to effective date, but there's other systems that have taken much longer.
Yeah, I would agree with Kathy. I think from the time that somebody or that an agency actually makes the decision to transition their retirees, and this is really the path that they wish to go down, to Kathy's point, I would say anywhere from 6 to 8 months to actually implement that process with those communication materials going out to each and every retiree. We like for our retirees to have a pre-season conversation with the benefit advisor before the enrollment season so that they're able to ask any questions that they have, of course express their concerns, comments that they might have. We also want to set up an enrollment appointment for them. And then of course to Kathy's point is what she had mentioned with the seminars, we want to be able to have the appropriate amount of time to get our team out to your retirees and get in front of them to present the solution. And then of course all of the communication that takes place there, and then the enrollment time frame when an agency terminates their program to the time the new plan takes place is they give of course a 90-day special enrollment period that using that year time frame would begin at the 1st of October running through the end of December to actually make that selection. But again, to Kathy's point, I think that takes anywhere from about 6 to 8 months once an organization has made that decision to move. But of course we have several clients that up to that point, from the time that we do the analysis review to the time that they actually make that decision to transition, sometimes it happens very quickly within just a few months of them going back to their negotiation teams, labor groups, and whatnot to discuss. From the time that we present the analysis, I've seen it take just a few months to make the transition and begin implementing. But I've also seen several organizations where they talk about it and kind of go through their routine within their agencies for sometimes a couple of years. And so I think that's kind of the process. I would say at least a year to a year and a half to really implement from the beginning conversations.
Thank you, Kathy and Chris. So Kathy, I think this question's for you. When ACERA was considering a retiree exchange, what do you feel like was most impactful in getting your decision makers to consider the option?
I would say it would be two things, and it was the cost impact to ACERA and then the customer service to the retirees. Of course, you also want to make sure you have plan coverage. You should have a goal for what you want your plan coverage to be. If you want it to be the same or better, or if you're trying to cut further costs and you're going to make a change, then that should be a consideration also. But for us, we already knew going into this that most of the exchanges had the Plan F coverage available. But it was just, a matter of how many carriers are out there to offer coverage within the different locations, and then, making sure that they're going to be supported not only during the implementation period, but on an ongoing basis.
Great,
and I think
just to touch on that
a little bit further, Amanda, I think the question was about presenting to board or key decision makers within an organization.
Yes.
And so I guess another piece to that would be, oftentimes when I'm having conversations with folks at different agencies, a lot of times the board doesn't start getting involved, or those key decision makers, until we're able to run that impact analysis and complete that complimentary exercise. It's free of charge to the organizations that we work with to really determine if this is even a viable solution or a viable option for them to explore further. And so oftentimes, we like to do that analysis right up front before presenting to that board, again, just so we're not wasting our time or your time in really determining if this is even a solution, possible moving forward.
Thanks for adding that, Chris. I think that's a really good point. So another question, and we may have covered this a little bit, but perhaps you can elaborate, is, is this a replacement strategy to our current group plans?
Yeah, I think I'll take that one. This is a replacement strategy that we're looking at here, and the reason for that is that we require our clients to terminate their existing group plan for the population that we're working with. Using this post-65 population, there's a lot of different groups and whatnot that can be within an agency, but we do require our clients to terminate the existing group plan, and that's what creates the special enrollment period for a retiree to select a program in the individual market and eliminate the underwriting capabilities of these carriers. When a retiree is losing coverage and an agency uses this full replacement strategy, the retiree is then able to go into the marketplace and choose any program they wish to apply for without any repercussions. And so that works for both the pre-65 and the post-65 space, and that's essentially why this is a replacement strategy.
Great, thank you, Chris. I appreciate it. That's it for our questions. Do Chris or Kathy, do either of you have anything to add?
No, I think our contact information is being provided, so if anybody has any questions, you want to shoot me an email or give me a call, I'm happy to answer them if I can.
Great,
And
thank you,
that's
Kathy.
what I'd say as well. Is this is simply we're here to serve public sector organizations in the state of California, helping them look at different benefit strategies of providing solutions to not only the retirees but their active employees as well. And we simply want to have a conversation, run this impact analysis for each and every city that's interested to see, again, if this is a viable solution moving forward, and to kind of show what the impact would be to the retirees as well as the city agency that may be exploring.
Thanks, Chris. And as you all know, Kathy mentioned the contact information for both Kathy and Chris are on the screen now. So if you have any questions, you are more than welcome to reach out to them or to the League as well. We really appreciate everyone joining, and as I said before, you'll get a recording, a copy of the recording and the slides after the webinar is concluded. Also next week on Thursday, May 11th at 10 a.m., we will have another webinar talking about the active employee side of things, and we'll focus on the benefits technology solution for cities. So we hope you can join us. You can access the registration link from the Health Benefits Marketplace website, which is cacities.org/HBM. And we really appreciate you all joining us. So thank you and have a great day.
Thank you.